This is the hip bone. This is the gluteus medius. It originates between the anterior gluteal line and the posterior gluteal line. This is the gluteus minimus, and it originates between the anterior gluteal line and the inferior gluteal line. This is the gluteus maximus. It originates between the posterior gluteal line and the posterior ilium. This is the piriformis, and it originates on the posterior inferior iliac spine. This is the tensor fasciae latae, and it originates on the anterior superior iliac spine. This is the sartorius. Sorry, this is the sartorius, and it originates on the anterior superior iliac spine. This is the origin for the rectus femoris, and it originates on the anterior inferior iliac spine. This is the rectus femoris origin as well, and it is superior to the acetabulum. This is the pectineus muscle, and it originates on the pectineal line of the superior pubic ramus. This is the adductor longus, which originates on the anterior inferior pubic body. This is the adductor brevis, which originates on the inferior pubic body and the inferior pubic ramus. This is the gracilis, and it originates on the inferior pubic body. This is the adductor magnus, and it originates from the inferior pubic ramus to the ischial tuberosity. This is the quadratus femoris, and it originates on the lateral ischial tuberosity. This is the semimembranosus, and it originates on the ischial tuberosity as well. And then this is the semitendinosus and the biceps femoris long head origin, and it originates on the ischial tuberosity also. This is the gemellus inferior, which originates on the ischial tuberosity. This is the gemellus superior, which originates on the ischial spine. This is the obturator externus, which originates on the external rim of the obturator foramen, and this is the obturator internus, which originates on the internal rim of the obturator foramen. This is the iliacus, which originates on the iliac fossa. And this is the erector spinae, which originates on the posterior superior iliac spine. And that's all of the muscles that originate on the hip bone. This is the femur, and we're going to start with origins. The plantaris muscle is originates right here, and it originates inferior to the lateral supracondylar line. This is the lateral head of the gastrocnemius origin site, and it originates lateral to the lateral condyle. This is the popliteus origin site, which is on the lateral epicondyle. This is where the medial head of the gastrocnemius originates, which is superior to the medial condyle. And then this is the short head of the biceps femoris, which originates on the linea aspera and the lateral supracondylar line. And then this is the vastus medialis, which originates on the medial diaphysis of the femur and the linea aspera. And then this is the vastus lateralis, which originates on the greater trochanter and the linea aspera. This is the vastus intermedius, which originates on the anterior shaft of the femur, anterior diaphysis of the femur. That's all of the origin sites for the femur, and then we're gonna go on to the insertion sites. We're gonna start right here. This is the obturator externus, which inserts on the trochanter fossa of the femur. And then this is the gluteus medius, which originates on the anterolateral greater trochanter. And then this is the piriformis, which inserts on the superior greater trochanter. And then this is the insertion site. I think I've been saying originates. These are insertions. So again, this is the piriformis, which inserts on the superior greater trochanter. This is the gluteus medius, which inserts on the anterolateral greater trochanter. This is the gluteus minimus, which inserts on the anterior greater trochanter. This is the quadratus femoris, which inserts on the quadrate tubercle and the intertrochanteric crest. And then this is the psoas major and the iliacus, which inserts on the lesser trochanter of the femur. And then this is the gluteus maximus right here. And it inserts on the gluteal tuberosity. And then right next to that is the adductor magnus, and it inserts on the linea aspera all the way to the medial supracondylar ridge. And then there's an adductor hiatus, and then the adductor magnus inserts on the adductor tubercle. And then right next to the adductor magnus is the adductor brevis. The adductor brevis is inferior to the popliteal line and superior to the linea aspera. And then right next to the adductor brevis is the pectineus, which inserts on the pectineus line. And right below that is the adductor longus, which inserts in the middle of the linea aspera. And then that is all of the insertions and origins for the femur. This is the tibia. This is where the soleus originates, which is on the tibial soleal line. This is the flexor digitorum longus, which originates on the medial aspect of the posterior surface of the tibial diaphysis. Yeah, this is the tibialis anterior, which originates on the superior half of the lateral surface of the tibia and the lateral condyle. And this is the tibialis posterior, which originates inferiolateral to the soleus or soleal line, tibial soleal line. So it's inferiolateral to that. This is the peroneus and the extensor digitorum longus, which both originate on the lateral tibial condyle. That's all for the origins. On to the insertions. This is the popliteus muscle, which inserts on the tibial soleal line. This is the semimembranosus, which inserts on the posterior medial condyle. And then this is the vastus medialis, which inserts on the tibial tuberosity via the patellar tendon, or the patellar tendon. And then this is the sartorius insertion, and the gracilis insertion, and the semitendinosus insertion, and they are all on the pes anserinus. And this is the IT band, which is on the lateral condyle. And that is all of my insertions and origins on the tibia.